Talking about addiction, Nabil, we're about to shift gears right now. So go ahead, Nabil, and tell us some facts about this wonderful program that we actually have for the society in terms of curbing addiction to heroin and also painkillers.
Of course, there is definitely some resistance about this idea of methadone treatment program because honestly, I am not familiar with the idea when I was first introduced about this topic. And a basic way of looking at it is that it is drugs against drugs.
That's a way to look at it as well.
That's a way to look at it. And that's why people are very hesitant about continuing this program, especially family members of the people who are undertaking the program. They're not sure whether this is the best idea because you can also get addicted to methadone. But that's why we have an expert in the studio today. Because we want to clear up all the confusion, all the things that we are not familiar about. And we are very lucky because we have SAKTHY DEIVI KUMARASAMY, a pharmacist from BATU MUDA Health Clinic with a background of 10 years in the industry, and we are very, very thankful to have you in the studio. Thank you for joining us, SAKTHY. First of all, SAKTHY, maybe we should start with this question. Maybe you can enlighten us, me, Brandon, and also the people at home, what is methadone treatment program?
Okay, first of all, before I start off, thanking you guys for having me here today. And okay, back to the question on what is methadone. As we said just now, methadone treatment program was started off by our Ministry of Health Malaysia in the year October 2005 with only 8 facilities in the government setting. But now we have methadone clinics throughout all the states in Malaysia. Okay, and back to the question on what is methadone treatment program. Its main component is for harm reduction program. Okay, which I mean is by having
some sort of, I would say maybe like a help.
Yeah, to improve the quality of life of drug abusers, especially on opioids. Example of opioids I would say is heroin and morphine. Because when the drug abusers they start taking in heroin and morphine, another way of they taking in is through injection. Okay, so when they started taking in through injection, they are more prone for blood-borne diseases, which is hepatitis B, hepatitis C, HIV, and AIDS. And after we started off with this methadone treatment program, there's a significant reduction in the number of new cases for all these blood-borne diseases, actually.
Right, okay. Just as you mentioned, doctor, that it's a type of a drug also and it's not associated. We would say it's probably type of a drug, once again, called opioids, right? And opioids is actually highly addictive. So when opioids are highly addictive, we have stats that show that people consume opioids for chronic pain, they often misuse them. Right, so in terms of misusing opioids or maybe part of this program, can someone actually misuse this program as a whole when seeking for treatment?
Okay, when the patient comes in to seek the treatment, I would say methadone is not addictive. It's same as like when you're having diabetes or hypertension, we are taking medications, which in a way, the medications are also drugs. Okay, so when it goes same to the methadone, you are giving medication to treat the chronic diseases, and it's not lifelong as compared to diabetes, hypertension, because as time goes on, they will slowly taper down the dose for the patients, and they'll be back to their normal life without any drugs.
Oh, there's like a window where you know you can exit. So that's actually good news.
And it's as Nabil said just now, that it's a drug to drug. Actually, even when you are having hypertension or diabetes, it's also drug. We are actually consuming drug. It's just the matter of illegal and legal. So when you are in the methadone treatment program, we are assessing their capability of taking the dose, what dose to take, and everything. So and definitely there's an exit door after a
certain session that's given to a
when
patient.
they are stable enough for the exiting.
Okay.
I think that is the amount that is the talking point here, because obviously when you're talking about drug abuse, it is the when you go overdose, when you go over a certain amount, then it has become drug addiction. But when it is when it's regulated very well, then it's not actually drug abuse, but it actually can help you.
Yes.
So maybe, because when you talk about drug abuse, some of the images that come to mind is injection.
Yeah, I mean, it has been tainted in that way.
Yes,
dark areas inside the building.
And spoons. So maybe you can tell us how do we administer methadone treatment program to the patients?
Okay, normally once the patients are given a dose, they will come in and we as pharmacists will administer the dose to them, which is in a syrup form. Syrup form, which I mean is will still be in red color. We will put them in the cup and they add on some amount of water for the patients and then drink in front of us, which is called as DOT, directly observed therapy. Okay, so they have to drink in front of us and then they can go back home. And for the methadone, once they drink, it can last for a period of 24 hours without any craving, such as for heroin and morphine, they have a craving after 4 hours.
Right.
Yeah. For methadone, it can withstand up to 24 hours to 36 hours.
Right. Wow.
So that's the reason why it's not addictive.
Okay.
Without any side effect.
All right.
Like for heroin and morphine, we will be having euphoria, highness, drowsiness. There's no such side effects in methadone compared to this heroin and morphine actually.
Right. Okay. For those of you guys who just joined us, welcome down to Fresh Brew. We are talking about this wonderful program, which is called the Methadone Treatment Program, where it helps addictions to heroin and also narcotic painkillers. Now, coming back to you, Doctor, when it comes to this particular treatment, now you've actually mentioned that this treatment works just for a short period of time. But how does it actually work? Because at the end of the day, are we looking for substitute or alternative? Of course, drug users out there, they want to help themselves. How is this suffice to them?
Okay, this is not a substitute.
Okay.
They have to come to the clinic out of their own willingness, whereby when they come in, we actually give them a consent form for them to sign to prevent the relapse of the patient. So, not to say substitute, it's just to improve the quality of life of the drug abusers.
There's an element in this particular program that is enough, or rather it satisfies, correct, the users. So in that sense, in this methadone program, what is it exactly that they are actually consuming, perhaps?
As I said just now, methadone is also an opioid drug as heroin and morphine.
So that is like a substitute to them that they can actually consume and then, of course, help them curb their addiction to...
without any craving for the drugs.
See, that's cool, Nabil. Because once you actually go through this program, you wouldn't have that addiction later on in the future. Or maybe you would, but it's actually, it suppresses the whole experience altogether. So that's the exit and the window that we're actually talking about.
Of course, it sounds like quite a complicated treatment program. I mean, I'm sure in your years of administering this program towards the patients, there have been some serious challenges and also issues. Maybe you can tell us some of the challenges that you guys have faced beforehand, and also maybe a success case. Maybe there is 1 or 2 patients that have been...
We definitely have success.
Maybe you can tell us a bit about that also.
Okay. The challenges... all the field we have challenges, right?
Yes.
Even a doctor, as you guys also should be having.
Yes, definitely. Nabil and his hair.
No, my hair is perfect.
Okay, so challenges there are. But for methadone treatment program, the main challenges is always from the society. Because as Nabil said just now, it's drug to drug. Is there exiting door and stuff like that?
Yeah.
Okay. It is drug to drug, but there is an exiting door. And there's no craving, no side effects. So your quality of life is improved. You can go to work, and social cases, problems are reduced. This is always a better option.
Sorry, maybe I have missed out, but can you tell me how long does this program last on average for one patient?
Okay, it actually depends on the patient's own body condition. If they think I'm not strong enough, I might go back to taking this. Then we will continue this program as long as they want. And once they believe, okay, I'm strong enough, I won't be going to taking this heroin and morphine, they can quit. But before quitting, let's say they have a higher dose, we will slowly taper down to see if they are enough to withstand the craving symptoms such as dizziness, body shaking, and sometimes they will say, oh, I'm having constipation and things like that.
Right.
And about the successful cases, we have plenty of them. And we can see even the kids are actually encouraging the parents to come, the father to come in to take the methadone. So they want the father to be back to normal, because we have a patients like 60 age, 70 are taking methadone. Yeah.
That's good to hear, actually.
16, 17 years old.
Yeah.
It's sad to hear these kind of stories, but at the same time, it's you know, it's a very happy story. You know, people are out there treating themselves well. You know, they want to turn over a new leaf, so on and so forth. But Doc, you just mentioned that, you know, when it comes to all this program, where can they actually go to? Because to be very honest, I'm not speaking on behalf of Nabil. I'm speaking on behalf of my own self right now. This is my first time hearing about this program when it was started, like when few years ago, 2005 in October to begin with. So how can we, as a society, do better to actually, you know, help other people out there? Look, there's a program that you can actually go to. Where do they look out for this program at?
Okay, for them to go and seek this methadone treatment, we can actually go to AADK, which is also known as Agency Anti-Dadah Kebangsaan.
Right.
Okay, or any other Ministry of Health facilities, because when they walk into any facilities, we are there to help them.
Right.
To check for them which are the facilities actually offering this methadone program, prisons, and also hospitals. Okay, prison and hospital, which means if let's say the patient got caught or they got admitted to hospital, we don't stop the treatment halfway.
Right.
Once the patient inform the person in charge, the treatment will be still continued until they got discharged or get back to their normal life from the prison.
So it's AADK and also any MOH facilities that you can actually check out this treatment program. Yeah.
I want to go back a bit, because just now you mentioned a bit about the side effects.
Yeah.
Obviously, you know, we are used to vaccinations and we are used to boosters. Of course, we are used to those side effects. Maybe you can tell us a bit about the side effects of this methadone treatment program. Yes.
Side effects, the normal side effects would be insomnia, constipation, chillness. But normally, once the patient get back to us and inform they are having insomnia, it means the dose we are giving for them is not sufficient enough. So what we do, we will increase the dose for them. And normally for dose to stabilize, it take 3 days.
I see.
So after 3 days, when we check back on them, they will say, oh, okay, now I can sleep better. So it's sufficient.
They will experience the side effects in the early phase of the program, and then after that, you guys will regulate the treatment so that the side effects will diminish.
Yeah.
That's good to hear.
Yeah, so once again, it's a type of drug called opioids, right? But opioids is something that people get addicted to. You know, when it comes to society, maybe they have this thought where if they undergo this treatment, they would also get addicted to it, and they need to rely on this methadone program for the rest of their lives. So is it a fact or a myth?
Definitely a myth, because once you started off with methadone, it's definitely exiting door, not like diabetes and hypertension. It's like lifelong. Throughout your life, you have to take the medication. But this, no. You can be back to normal life without this methadone.
That's...
Yeah, I mean, I would say that this has been a very fruitful discussion, because thank you for teaching us about this program. I mean, when I first read about it, I was a bit confused. I wasn't sure with this idea, but I mean, having you explain it to us has been very, very enlightening. So I thank you so much, SAKTHY, DEIVI, because this has been very fruitful. And I think that this is something that we should tell our family and friends also, because I think that a large portion of society is still not familiar with this.
They're not familiar. Maybe it's because, well, I'm not too sure. I don't want to speak on behalf of anybody, but what's important is that we as friends and we as family members, part of it, we need to actually understand what this program is all about. And of course, just share it around. You know, you don't have to be too shy to share this around, because at the end of the day, people out there, they are really having some serious issues. Yeah. So, Doc, of course, we need you to also give us message and advice if we want to like put it out there to people. How can we actually do better? What do we need to do? Is it just like the word of mouth, or we need to find out more infos about this particular program and let them know? Or is there a way that we can actually do it so easily?
Okay. To get information on this Methadone program, they can walk into any Ministry of Health facilities, and we are there to help. And I have a message for society and also drug abusers, if you don't mind.
Yeah, sure.
Yes, of course.
Okay. So for the, as we all know, most of the society people, they think methadone is solely on healthcare workers, drug abusers is only healthcare staffs, they need to take care of them and things. But it's definitely a responsibility of everyone. Okay. You can't be treating a drug abuser with only methadone. You need the counseling and support from the family and society. We can't say, wow, you're taking methadone. You are a drug abuser. I cannot talk with you. I should avoid myself. It's not like that. Okay? It's because counseling and social support is very, very important. And for drug abusers, okay, we from Ministry of Health are always there to help them, and they can walk into any facilities to get their health screened, drug sample checked and everything, and we will supply them methadone syrup and the treatment free of charge.
Okay, I think the question here that is quite out there, you know, even though drug abusers, if they're afraid of coming forward, if they come forward, are they in trouble?
Definitely not, because their information, data, everything is kept secret by Ministry of Health, and we are not even leaking out the information to the police. There's no such thing as, oh, the police is coming in, I will give the information. For methadone patients, it's a top secret.
Yeah, so
confidentiality is there.
Yeah, because I mean, a drug addict wouldn't just come up and say that they need help, right? I mean, because they are scared. They're scared to, you know, get caught or so on and so forth. But it's great to know that once they come forward for this program, they are safe.
Yes.
Once again, thank you so much, SAKTHY Devi KUMARASAMY, Methadone Treatment Program. She's a pharmacist from BATU MUDA Health Clinic. Thank you so much for being here.
Thank you for having me.
Yeah.
Thank you.